Not saying that the symptoms are made up or anything like that. I'm just saying that psychological things like anxiety, stress, depression, post-traumatic stress disorder, etc., not only all look like concussion symptomatically, but the brain profiles on imaging, so special imaging techniques like fMRI and diffusion tensor and all these fancy imaging techniques that are coming out, SPECT, which looks at blood flow, the findings on these imaging things are the same. People with PTSD just look exactly like people with post-concussion syndrome. People with whiplash look like post-concussion syndrome. People with anxiety look like da, 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 da. They look the same. Not only are they essentially very similar, if not the same, the treatments that help those conditions, anxiety, stress, depression, PTSD, etc., also help patients with concussion. One of the top treatments for patients with chronic persistent concussion symptoms that was actually referenced in the Berlin statement is cognitive behavioral therapy, right? And it's not, like I said, this is not saying that your symptoms are psychologically driven, that you're thinking them. No, it's that the anxiety of having these symptoms will cause the same type of symptoms. So now the symptoms you're experiencing, are those due to the actual post-concussion symptom, or is that due to the anxiety you're experiencing about still having symptoms? Or the fact that you haven't been able to work in 6 months, or the fact that you're not getting a paycheck anymore, or the fact that your disability is getting cut off. All of these things, the symptoms are the same, right? Anxiety starts to make you feel dizzy and disoriented and confused, and you can't concentrate well. Why? Because there's so much going on in your brain that you're just thinking, and you can't clarify, you can't think straight. So the treatment for this is go to therapy. Find a psychologist, psychiatrist, social worker, some sort of therapist to help you through this. If you don't want to do that, meditate. I try to meditate every day, and it's really, really helpful, actually. I just started a couple months ago, but it's really, really helpful. Exercise, okay? Exercise kills two birds because it also helps the blood flow thing, and it'll reduce stress, reduce anxiety, improve endorphins and blood flow and everything else. Go out with friends, socialize. A lot of times with concussion, people become socially isolated. They don't want to go out and hang out with their friends because they're worried about feeling symptomatic. Well, again, this kills two birds. One, you're exposing yourself, and two, you're socializing. I'm not saying go out and spend, plan to spend 3 hours there, but go there and just say, look, I'm going to chill for like 20 minutes and see how I do, and then I'm just going to go home. Make an appearance, start socializing, because you'll feel better just socializing. Talking with people gets your mind off of all the stuff that's going on inside your mind, which serves to reduce your stress, right? People that are socially isolated are often anxious and depressed. And that's what happens to concussion patients, because you go to these people that keep telling you to avoid everything, and it's the wrong idea.